Modern liberals like Barack Obama think that the Constitution is completely outdated and totally inadequate to dealing with the problems of our time. And while they'll pay lip service to the Constitution because they can't get elected otherwise, the ideas for redistribution and the extension of federal authority that they want to implement are completely hostile to the Constitution.
Here we have the health care bill that wants to regulate about a fifth of the economy. They want to take everything that is currently both public and private and turn it into a public thing, to have the government control almost all aspects of the health care system.
Universal health care is a positive right. And since the federal government has no money, the only way it can give everyone health care is to redistribute wealth from one American to another.
There is an ideological underpinning to this health legislation that has nothing to do with covering the uninsured. It's to reduce the amount of health care consumption everyone gets, to control how much health care they get, and to eliminate any difference in health care experience based on ability to pay.
The Obama administration's plan to reform health care is simple. They want to bring all 300 million Americans into a government-run health care plan and use rationing to control costs.
The purpose of this legislation is to reduce the amount of health care everyone can get. So that's why everybody has to be in an HMO, because only HMOs can actually limit your care.
The founders insisted that free choice was given to all men from God. This was something government could not take away from you. It is the foundation of man's natural rights. But under Obama's plan to promise everyone the right to health care, he is eliminating the right to choose from all Americans.
No, you are not permitted any longer to decide that you can be one of the uninsured. That is not part of your liberty anymore. You must buy the plan. And if you go to file your taxes and you haven't complied with this legal requirement, if you're not in one of those qualified plans, you will be fined thousands of dollars.
This is slavery, when you force people to do something they do not want to do.
A statement from the Joint Committee on Taxation confirmed Americans who fail to comply with these new requirements will face fines as high as $250,000. The committee also noted that Americans can even be jailed for up to 5 years.
Once every American is forced into the federal government's health care structure, then each doctor will use protocols dictated to them from government bureaucrats to determine the course of treatment for each and every patient. This is progressivism at its finest. Rather than trusting the educated judgment of physicians, this authority will be delegated to a group of experts set up by the executive branch. Omnipotent bureaucrats will now have the power to heal the sick.
Slipped into the stimulus package that was signed into law on February 17th were two health care provisions that virtually no one discussed at the time. One was for electronic medical records. Now, it sounds great. If you have an emergency and you have to get to the hospital, your records will get there ahead of you. But the real purpose of these records was just not your convenience. The real purpose was to deliver protocols to doctors electronically on what the government deems cost-effective and appropriate care. And when I wrote about that just before the stimulus legislation was enacted, all the major media said, oh, she's exaggerating, this couldn't be true. They're not going to try and control what your doctor does. But in fact, soon after the legislation was signed, the president appointed Dr. David Blumenthal to be National Coordinator of Health Information Technology. And on April 9th, Dr. Blumenthal actually published his article in the New England Journal of Medicine explaining exactly how he was going to use this new electronic system. And it is to control doctors. And he explains in the article that he expects many doctors will resist this intrusion in the doctor-patient relationship. He says some will petition Congress to repeal the law, and others will simply endure the penalties rather than deny their own patients care that's needed.
They're going to tell the doctor how to treat diabetes. They're going to tell the doctor how to manage hypertension. They're going to tell a doctor when they can give you your triple bypass and when you can actually qualify for one.
Now, they will say, no, the patient will still have lots of choices. They will have the choices that the federal government says that you can have. They will allow certain procedures that the federal government says that you can have. That is not patient empowerment. That is bureaucratic empowerment.
This is how the Obama administration and majority in Congress plan to reduce the cost of medicine by rationing treatment. Total costs will be decreased by refusing to pay for treatment of people deemed unworthy of receiving it. Americans over the age of 65 and premature infants move to the bottom of the list.
Almost half of this bill is paid for with reductions in Medicare. $500 billion in cuts to Medicare over the next 10 years. That's about a 10% reduction in the Medicare budget, at the same time that 30% more people will be enrolled in Medicare as the baby boomers reach age 65. So many more people and many fewer dollars will necessitate real rationing. And what is it going to mean? It's going to mean fewer hip replacements, fewer knee replacements, fewer bypass surgeries, fewer angioplasties.
Medical treatment will be given first and foremost to those who contribute most to society. They will receive priority over those who are unable to contribute as much. A senior in the twilight of life will be considered less worthy to receive medical treatment than a younger person who is still in the prime of life, still working hard, and still paying taxes. But seniors aren't the only Americans who do not work. Many Americans are too seriously ill or disabled to contribute to society at the same capacity as others.
The health bills in Washington are health plans only for the healthy. So if you or your family is coping with serious illness, cancer, Alzheimer's, cerebral palsy, MS, Parkinson's disease, these plans are going to limit your care. Dr. Ezekiel Emanuel, the president's chief health advisor, has written extensively on this issue, and he argues that people with irreversible disabilities or incurable diseases should not be guaranteed even basic health benefits because, he says, they no longer contribute to society. He calls himself a communitarian, and he wants to make decisions for the general good.
Dr. Emanuel supports replacing the Hippocratic Oath with the Complete Lives system, which limits care to the elderly in favor of Americans aged 15 to 44 who have the best chance to live a complete life. This is one reason why reductions in Medicare are being proposed to pay for the uninsured.
This bill actually offers a new Medicare benefit: counseling on how to cut your life short.
This end-of-life counseling would specifically teach seniors the benefits of foregoing nutrition, hydration, and antibiotics.
And the creation of educational tools to deliver this message. This does not belong in federal legislation.
Like eugenics of the early 20th century, a healthcare system that employs rationing will give government bureaucrats the power to choose which Americans are more worthy than others, whose lives are valuable, and whose are not.
And by the way, we are going to have to, if you're very old, we're not going to give you all that technology and all those drugs for the last couple of years of your life to keep you maybe going for another couple of months. It's too expensive, so we're going to let you die.